In this video, we'll be discussing the Family Medical Leave Act and how it can massively help families impacted by MS. Don't turn away because all of that starts right now. Howdy! Thanks for learning about MS with me, Boster. If you or someone you love is impacted by MS and you want to up your game, make sure to hit the subscribe button and ring that bell so you don't miss any of my future content. Today's video is pretty darn important. We'll be discussing the Family Medical Leave Act and how it can improve the lives of families impacted by MS. Get out a pen and paper and take some notes, and let's jump in. The Family and Medical Leave Act, or FMLA, is a United States federal law which provides eligible employees with up to 12 weeks of unpaid job-protected leave for various family and medical reasons. Here's how it works. To be eligible for FMLA, an employee must work for a given employer for at least 12 months. They must have worked a minimum of 1,250 hours in those past 12 months. The employer has to have at least 50 employees who work within a 75-mile radius from where that employee works. FMLA provides eligible employees for up to 12 weeks of unpaid but protected time off for certain reasons. These include, 1, the birth of a child and then caring for that newborn child. 2, the placement of a child into adoption or foster care and then caring for that newly placed child. 3, to care for an employee's spouse, child, or parent who has a serious medical condition. This allows the employee to be at home to provide care for that family member and preserve their job for when they return. 4, a serious health condition affecting that employee that makes it so they can't work at that time. And 5, to care for a covered service member if the employee is a spouse or first-degree relative of that service member. A quick comment about notice requirements. An employee who needs to use FMLA leave needs to inform their employer and provide notice for that need. And the employer may require certification of the serious and qualifying medical condition. One of the huge benefits of FMLA is job protection. FMLA provides job protection for the employee when they leave. Now what that means is when they return back to work, they need to be reinstated in that same job or an equivalent job and have the same pay and the same benefits and the same terms of employment. So FMLA affords up to 12 weeks for qualifying employees to be off each year, but not paid. Oftentimes, an employee may seek alternative ways to be paid, such as taking sick leave or taking vacation time. So with that background, let's turn our attention to how FMLA can massively help a family impacted by MS. 1, for the human with MS, if they're a qualifying employee, this affords them time off so that they can have their disease taken care of, so that they can seek medical attention to go to see the neurologist, to go to see the physical therapist, to go to have their infusion therapy. MS is a chronic condition, and we can use FMLA to take time off for scheduled and unscheduled doctor visits. Likewise, FMLA can be used so that patients can manage their own symptoms. People impacted by MS have a host of symptoms which could interfere with their ability to do their job, and many of them, frankly, are invisible, like profound and pathologic fatigue. When someone is recovering from a relapse, they may literally need some downtime to recuperate, and they can use FMLA to have that time off and keep their job protected. That's a big deal. 3 is a really big one, reasonable accommodations. FMLA also requires the employer to provide reasonable accommodations so that that employee can be successful. This can include things like changing the work environment or adjusting their schedule to allow them to be successful despite having MS. Lastly, and also very importantly, FMLA isn't just for the human being who is an employee with MS. It's also for that person's spouse or family member. So if you have a loved one who has MS, you can apply for FMLA and use all those same benefits so that you can be there for your loved one, to help take them to a doctor's appointment, to help accompany them to their treatment, to help accommodate your job schedule so that you can be there for your loved one with, at the same time, protecting your own job. How to apply for the Family and Medical Leave Act. Follow these steps. Number one, we need to check eligibility. FMLA applies to employees who have been at their job for at least 12 months and who have worked a minimum of 1,250 hours in those last 12 months. The employer must have at least 50 employees that work within a 75-mile radius of the employee's location of work. You can ask your HR team if you qualify for FMLA. Number two, notify your employer. If you need to use FMLA leave, you need to formally notify your employer before taking it. You may be required in some places to give up to a 30-day notice. Now, realistically, if that's not possible, let's say, God forbid, you had an attack, you just want to make sure to notify your employer as soon as you're able to do so. Number three, completing the necessary paperwork. Your employer may require you to complete some documentation, such as an FMLA leave form or a medical certification form. Again, I would encourage you to talk to your HR department to find out which forms need to be completed. Number four, providing medical certification. If the FMLA leave is because of a serious condition that you're facing or your loved one's facing, the employer may require a medical certification from your provider. As an MS neurologist, this happens frequently in our clinic. The patient or family will bring to us the forms and then we will complete them. A word to the wise, it takes a while to fill out those forms. For example, at the Boster Center for MS, we ask for a minimum of 3 business weeks so that we can make sure that we get it done properly. Be planful and make sure that you can get that form to us ASAP so that it's not delayed in getting back to the employer. Number 5, coordinate with your employer. You want to work with your employer to set up your FMLA. The employer may require you to use accrued paid time such as sick leave or vacation leave during your FMLA time off. The employer also may require periodic updates about how things are going and when you think you'll be able to return to the workplace. It's ideal to sit down and talk to the HR department to find out the specifics for using FMLA at that particular workplace. If this video provided you value, please give it a thumbs up. And if you haven't yet subscribed to the channel, please consider doing so. The biggest thing you could do, however, to help this channel grow is to watch another video. So click the one that's on your screen right now. And until next time, this is Aaron Boster saying be safe and take care.